Welcome to this presentation. My name is Hortense Gallois. I'm an academic associate for the Center of Genomics and Policy of McGill University in Canada. This presentation is based on the results of the research conducted with my coworkers about the implication for privacy of the integration of artificial intelligence into healthcare. We're going to focus today on three data protection frameworks: the EU one, the Canadian one, and the American one. Welcome to this presentation. My name is Hortense Gallois. I'm an academic associate for the Center of Genomics and Policy of McGill University in Canada. This presentation is based on the results of the research conducted with my coworkers about the implication for privacy of the integration of artificial intelligence into healthcare. We're going to focus today on three data protection frameworks: the EU one, the Canadian one, and the American one. AI has already been integrated into healthcare in some ways. In clinical care, AI is now mostly concentrated around three areas: oncology, neurology, and cardiology, which are fields in which accuracy and efficacy are central. AI technologies are already used to help decision-making and diagnostic. When combined with imaging, for example, some studies have shown that AI technologies can be more accurate than trained doctors to detect skin cancer. AI is also used to develop electronic health records, telemedicine, or care bot for the elderly. In research, AI is, for example, used to help identify the optimal cohort for a research project. Public health has taken the center stage in 2020. In that context, AI fluid models are increasingly considered to help design more efficient public policies. Precision public health, for example, aims at delivering the right intervention at the right time, every time to the right population. AI has already been integrated into healthcare in some ways. In clinical care, AI is now mostly concentrated around three areas: oncology, neurology, and cardiology, which are fields in which accuracy and efficacy are central. AI technologies are already used to help decision-making and diagnostic. When combined with imaging, for example, some studies have shown that AI technologies can be more accurate than trained doctors to detect skin cancer. AI is also used to develop electronic health records, telemedicine, or care bot for the elderly. In research, AI is, for example, used to help identify the optimal cohort for a research project. Public health has taken the center stage in 2020. In that context, AI fluid models are increasingly considered to help design more efficient public policies. Precision public health, for example, aims at delivering the right intervention at the right time, every time to the right population. The main goals and expected benefits of integrating AI into healthcare are saving time and resources, but also to reduce human error through help in diagnostic and decision-making. It also aims more generally at making the healthcare system more efficient. But all of that is conditioned by accessing the fuel of AI, the data, which in our case is often health-related and highly sensitive. So we understand that to develop accurate and relevant AI technology that can improve our healthcare systems, we need vast amounts of data. And here, researchers are facing the consequences of a phenomenon now known as the privacy paradox. The privacy paradox is now defined as the discrepancy between an individual's intention to protect their privacy and their actual personal information disclosure behaviors online. Ultimately, this ambivalent attitude will result in a reluctance to share data in a context of care or research. Governments and legislators are now faced with the task of responding to this concern in order to generate trust among data sharers. But how to go from there? How to respond to genuine and understandable concerns from patients and participants regarding the respect of their privacy, while facilitating the access to relevant data for research. In the year 2018, the European Union officially enforced the General Data Protection Regulation. This text is the most advanced data protection framework ever adopted. The GDPR is quite novel in its purpose. It is dual. On the one hand, the GDPR seeks to strictly prevent unconsented and secondary uses of personal data, both by the private and the public sector. On the other hand, it aims at streamlining access to personal data necessary for the development of research. Due to its large scope of application, many non-EU companies are concerned by its dispositions. For example, any company dealing with personal data related to the action and behavior of individuals when they are physically present on the EU territory are concerned. Imported data is also covered, which means many foreign companies must comply. As an example, Google was heavily sanctioned in 2018 based on the regulation due to a lack of clarity when seeking users' consent. The GDPR is also broad in its application. Since it concerns virtually any data that isn't either strictly non-personal or properly anonymized, de-identified information are still covered by the text. Personal data is then defined as any data that allows re-identification either directly or indirectly. Also, data concerning health, genetic data, and biometric data are considered highly sensitive and are assigned a more protective framework by the GDPR, although exceptions for research can apply. The GDPR first of all reinforces the rights of individuals over their personal information. The consent requirements are more stringent, imposing that consent be explicit, informed, and limited to predetermined purposes, with again interesting exceptions for research. The GDPR also sets up novel rights, such as the right to data portability and the right to erasure. This last right, also known as the right to be forgotten, implies that all personal data can and should be deleted at the individual's request. The goal is to give data owners a greater sense of control over their information. Another interesting right is the right to human justification to automatic decisions. This right makes a lot of sense in the healthcare context. Studies in Europe and the US have shown that patients are largely reluctant to letting technology be the basis of decision regarding their health. The principle of accountability is central in the GDPR. The idea is to engage all actors dealing with data into the protection of privacy as a common and continuous effort. The GDPR sets up interesting preventive mechanisms like privacy by design and privacy by default, which mean that data security is ensured from the conception of the process. It also requires, in most cases, that a privacy assessment be made prior to the collection. In order to facilitate research, the GDPR lowers the declaration and administrative requirement to national authorities, but they give them more power to investigate and sanction violations, requiring keeping records of activity. In order to increase accountability and encourage preventive behaviors, the penalties in case of breach are significant and dissuasive. Now let's take a look at how health data is protected elsewhere. In the United States, data protection is the result of a patchwork of sectoral regulations. This leads to some loopholes in the global protection of personal data. For health data in particular, HIPAA, the Health Insurance Portability and Accountability Act, applies. The strength of HIPAA resides in its high penalties. Also, like in the GDPR, HIPAA offers stricter protection over health information. But in practice, HIPAA has a very limited impact. Its restrictive scope of application does not cover de-identified information and is eventually limited to a handful of covered entities. Typically, big tech companies are easily excluded from HIPAA's scope of application. Also, HIPAA does not guarantee an adequate control over data processing, and as it only recommends periodical risk assessments. Finally, since no independent authority is appointed, the text dispositions are difficult to enforce. In Canada, health data protection is divided between the private and the public sector. The Privacy Act regulates public bodies and agencies at the federal level. Meanwhile, the Personal Information Protection and Electronic Document Acts, also known as PIPEDA, and its provincial equivalents, cover data collected and processed by the private sector. Although lacking a categorization of sensitive data, PIPEDA's scope of application is rather extensive. However, a risk assessment is only mandatory for federal public bodies. Also, the tech lacks of a dissuasive sanction system, as maximal penalties are comparatively low and the Privacy Commissioner has limited powers. The GDPR has put into question the adequacy status of Canada with the EU. If such status is no longer granted, the importation of personal data from the EU would be hindered. Fearing the consequences for data exchange, a reform project in Quebec, known as Bill 64, is currently under study, integrating some aspects of the GDPR. Despite the several interesting mechanisms and rights set by the GDPR, there are still certain points that could be improved and should be taken into account when reforming data protection regulations abroad. Especially, establishing dynamic consent as the norm might be restrictive for research, as it implies to re-seek participants' consent regularly, which might be draining for researchers. Also, the right to erasures and the data portability right can be technically difficult to ensure. Despite this limitation, the general effort toward increased responsibility of data actors must be acknowledged and should inspire the adoption of more productive regulations. To conclude, we believe that the GDPR offers very interesting principles and mechanisms that other countries should consider. Simplifying declaration formalities is recommended, but only in the context of increased accountability and self-regulation by data actors. Adopting an efficient investigation and sanction process assorted with high penalties is also a good call. Some novel requirements of the GDPR could be in turn slightly adapted in order not to restrain research. For example, if we believe improving consent process is necessary both in the US and Canada, we don't think the dynamic consent recommended by the GDPR is necessary. Instead, making broad consent the norm could facilitate researchers' work while still guaranteeing individuals' protection. Also, if data portability and the right to erasure are interesting mechanisms, they should be implemented in a way that isn't burdensome for researchers or hindering the continuity of care for practitioners. Ultimately, developing a compatible international framework to protect personal information that enables responsible data sharing and cross-border data transfers would be beneficial to all parties. Thank you for your time and attention. I hope you enjoyed this presentation.